Hello, beautiful people, and thank you for checking in into this lesson. And in today's lesson, I'm going to talk about the learners with autism spectrum disorder, that is the ASD. These are the learners who are living under these difficult circumstances, and we are going to talk about many of them. But in today's lesson, we are going to start with the ones with the ASDs. So, what is the autism spectrum disorder, the ASD? It is a neurodevelopmental condition characterized by challenges in social interaction, communication, and the presence of a restricted or a repetitive behavior or interest. A neurological or a developmental condition, it affects how a person communicates, how the person interacts socially, how the person behaves and processes information. And it is called a spectrum because it varies in variety and in characteristics. I believe that you people have met such kind of learners, such kind of kids who are dealing with this condition, and it is a lifelong condition. Characteristics of learners with the autism. Let us start with communication. These learners, they may have difficulties with verbal and nonverbal communications, including understanding and using language. This may become a challenge to them. When you meet them, they may not understand most of the language you communicate with them, so that is one of their characteristics. And in social interactions, they have challenges in social situations such as difficulty understanding social cues, making friends, or sharing interests with other people. Like, you'll just notice how they interact with other people. It's not as other students interact with each other. So they have a problem with social interactions. Then when we come to behavioral patterns, they may exhibit repetitive behaviors, have intense interests, or struggle with transition and changes in routine. For example, like the repetitive behavior, like they will be repeating doing something. If it's beating on a wall, that is what they will be doing. They will have a repetitive, a pattern, a behavioral pattern that you will recognize every time you see this person. Then about the sensory processing, they may experience sensory sensitivities such as being very overwhelmed by loud noises or bright lights. Like, these are the learners who you should be very sensitive with, because when they hear some big noises, a lot of noises, or a lot of light, they have some tendency, they are very sensitive, and it doesn't really work well with them. And about their learning styles, they often learn best through visual aids, structured environments, and consistent routine. Each learner is unique and the characteristics vary. But you can understand that their learning styles, they are not the students who you'll just sit with them in class with other normal students and you teach them and they would understand like the rest. No, these students, they require visual aids, what they see, in order for them to grasp what you're trying to teach them. And their emotional regulatory difficulties, they tend to, sometimes they will just start crying, they will just start doing things, and it becomes hard for them to regulate them to become okay, like to be okay in a way that they are at peace. And restricted interests, sometimes they get interested with things that are not really good for them. So difficult circumstances they may face. Most of the children who have autism, they may face poverty and lack of basic needs, right? Limited access to therapy or special education, neglect or lack of parental understanding, sometimes even parents cannot understand them, bullying or social exclusion, inadequate learning resources in schools, and emotional stress and trauma. This increased anxiety and behavioral. So these difficult circumstances, they affect learners. Increased anxiety and behavioral maybe changes, slower academic processes, they reduced communicational development, poor social integration, and higher risk of isolation and depression. Then what are the adaptive skills necessary for learners to function in an inclusive setting? The social skills, number one, skills for interacting with peers, understanding social cues, and managing social situations. So they will have to acquire the skills in which they will interact with each other, They understand some social cues, that this is this and that, right? Yeah. And in the communication skills, it is very mandatory, because abilities to express need, they will have it. Understanding instruction and engage in conversation. So once they have this skill, it will become easy, as much as it's not as the rest of them. But once they grasp some of the communication skills, it becomes easier for them to adapt. And the self-regulations, these are the skills for managing emotions, coping with stress, and controlling impulses. So they have to be trained on how to regulate themselves. Not when something has happened to them, you just leave them to maybe cry, maybe to make noise. No, you have to help them so that they may have the skill of self-regulation. Daily living skills, ability for self-care, such as dressing, eating, and personal hygiene. It is mandatory for them to understand that they should dress well, they should eat, they should know how to eat, to brush their teeth. These are skills that they need to have in order for them to function in an inclusive setting. And executive functioning, these are skills for planning or organizing and completing tasks. These skills, they will help them in navigating the classrooms and social environments effectively. Then, what are the instructional strategies for facilitating learning to learn for the learners with ASD? Structured teaching. That is, using clear routines, visual support like schedules and visual codes, which we talked about, and organized learning environment to reduce anxiety and promote understanding. The environment in which these people are going to learn, they should have a familiar setting for them. Not today you have this, another one to do, tomorrow you have this. That change, that drift will bring anxieties in their life. So there has to be a structured teaching, a visual support, that is employing visual aids such as pictures, flashcards, diagrams, and written instructions to support comprehension and communication. Social stories, that is creating personalized stories that describe social situations and appropriate behaviors to help the learners understand social expectations. All right. And what about the task analysis? Breaking down complex tasks into smaller, manageable steps to facilitate learning and promoting their success. When something is big, when the task is big, break it into small pieces for them to understand and to rely on, and to go slow with it in order for them to comprehend it. The reinforcement. I remember in one of my YouTube videos, I've talked about B.F. Skinner. What about the reinforcement, right? So reinforcement, it's using positive reinforcement such as praise and rewards to motivate learners and to encourage desired behavior. So like when something good has happened and they get to do something about it, their behavior, you encourage them, they will repeat to do it through the positive reinforcement. And individualization, with just the word, tailoring instructions to meet the unique needs and strengths of each learner with autism, providing personalized support and accommodation, which is really mandatory. The learning resources, I've talked about the visual aids, that is the pictures, assistive technologies, maybe tablets, speech generating devices, sensory tools, fidgets, weight blankets, social stories, structured work system, and specialized curriculum are mandatory. Then in conclusion, learners with ASD, they need understanding, they need patient and structured support. Difficult circumstances can worsen challenges, but support can improve outcomes. Difficult circumstances can worsen the challenges, but support can improve outcomes. Inclusion ensures every learner has a chance to succeed. So these kids are lovable. These kids they need patience. They need motivation for them to succeed in an inclusive setting. Otherwise, thank you for joining in, and I believe that you have grasped something. Subscribe, please, and like the channel.